Hello and welcome to a Business Minute with Lily Lopez presented by the South Florida Hispanic Chamber of Commerce. I am at the headquarters of Cano Health with Dr. Marlow Hernandez, the CEO of this extraordinary organization. And just as he came here to sit down with me, he showed me this beautiful flag that flew over the Capitol that was presented to them recently in Washington, D.C. And what an honor that was. Dr. Marlow, tell me about that before we go into the deep conversation and everything about healthcare and all the things that you've accomplished. How did it feel as a Cuban American to be in
this
D.C.
It's
in
hard to describe,
Congress?
Lily. It's hard to describe because my parents crossed the Rio Grande 30 plus years ago to give me freedom, to give me opportunity, and they were illegal because there was really no other way for them to escape the dictatorship of Cuba. And also, once they got to Central America and trekking up to North America and through the Rio Grande, there was really no other means for them to attain the liberties, the freedoms, the opportunities. And for 30 years later, for us to be building in those same places and to be presented with the flag, this same family, this same idea that I think is so consistent with our country, that flag that flies atop our Capitol building that says, I'm going to judge you by your merits.
Exactly.
I don't believe in hereditary titles.
Yeah.
I am a meritocracy. I am an e pluribus unum, out of many, one. I am a country of laws, of free markets.
Exactly.
So I did not expect it. And I would say professionally, the proudest moment of my life accept the flag very humbly on behalf of all of us here at Cano Health.
I love it, and congratulations. So tell me, when, why, how was Cano established? Is it a family business,
Sure.
but who started Cano Health? Tell me a little bit of brief history.
Yeah, so Cano Health opened in 2010, but the story began well before that. My mother, Lourdes Cano, dentist from Cuba, she stressed the importance in me education and medical care, and that would pay off heavily. My family and I fled the island when I was just 8 years old, not knowing English, but we had a passion for service, for medicine, and I followed in my mother's footsteps. I saw how she cared for patients and the impact that she had on those patients, how much they loved her and how essential it was. So when in 2008 I saw people losing insurance and not getting that critical access to care, which prevented them from achieving their own definition of success, I felt compelled to start a medical company, what is now Cano Health, to provide that access to care in an affordable way, but also in a comprehensive way, in a holistic way, in a different way that mixed the high quality that we know and can expect from maybe the best systems around our country, but also that relationship, ese calor humano, that human touch and that family atmosphere.
Toque hispano, muy importante. So I know that Cano is now a publicly traded company.
Right.
That's such an honor, I imagine, for your family, not only for you, but your mother, your father. So what are the future plans? Because that's a very big thing in the United States of America.
That's right. Well, in 2014, we saw an opportunity to expand this mission that is Cano Health, this movement that it has become of high quality care and lifelong bonds. I partnered with Dr. Richard Aguilar, our Chief Clinical Officer, and expanded our model into Miami. Initially, we weren't founded in Miami. This is Pembroke Pines, Broward, although South Florida in general. And then we took it to Puerto Rico and to Texas and Nevada. And the business community just saw what we were doing, wanted to be a part of it because we were doing something that the market desperately needed, that was measurably better, and that also worked from an economic perspective for all stakeholders, for our associates, for communities, for the jobs that we create, yes, but also the lives that we're able to change and the families that we're able to help.
Right.
And as a result of that, the market supports it and allows us to grow in a bigger way and have very healthy margins along that way. So where are we going?
And
very simple.
And the secret to the success?
Well, I don't know that I can talk about all the secrets, but I can tell you that if there is a secret, is just having that passion for the patient and placing him or her above everything else. And so we designed a care platform that rather than having a patient or a community adapt to us, we're adapting to them, to him, to her, in a personalized way. Because there is no diabetic. There's just a patient with diabetes. There is no public health. There's just the specific needs of that community, and then building a platform that ensure we can touch as many patients as possible, get them through this holistic services in personalized ways, through the resources that expand far beyond just what people get at the clinic. It's what they're getting at home. It's ensuring they're taking their meds, that they're getting their referrals, and we're getting that data, and that we are proactive in the care rather than just waiting for a patient to come with complication. That's the secret. That's what Cano Health is all about, and where we're going at the end of this year. We should be at 180 plus medical centers operating now in 10 states in the territory of Puerto Rico. And this is truly just the beginning, because our vision is to become America's primary care, and we have never been shy.
I know you want to be a leader, right, in primary care. So how are you doing that?
Well,
you're already in your way.
Well, we're on our way, and
very
the way
close.
that we're doing it is it's very simple. We have a big need for healthcare access in our country. We have a big need for quality and accountability to ensure that healthcare is equitable, that is affordable, that works for everybody. And so we're building that clinical capacity, that critical capacity across the country. And at the same time, we're getting better results than anybody else. And when you're able to lower mortality, when you're able to lower cost while measurably improving quality, well, then that's something that's really special. And that's why we're growing so fast.
And you have a passion.
Of course.
Tell me about that passion. Because I'm seeing that passion, very much so.
Yeah, well, that passion, I think, comes from a calling, comes from a spiritual purpose that I believe we all have. And once we find it, we truly are able to be fulfilled and have that peace and that happiness. It comes from upbringing. It comes from values. And for me, it comes from our associates and our patients.
And you're excited about the future, right? You're excited about the future of Cano, right? I could see it. I could see it.
Right.
I could see the passion
in
you. And anything else that you would like to say? Because this is a short segment. The Business Minute is always like 8 to 10 minutes. And I know that with you, I could do an hour show. We could do a whole hour. Yeah. Anything else that you think that I'm leaving out? I know I have a question. What separates Cano Health from other healthcare providers? Yeah. I knew I had that pending.
Yeah. Well, what separates us is that
what makes you so special?
Yeah, is that we don't just talk the talk. We walk the walk. And I would invite everyone to come into our medical centers, talk to our patients, talk to our staff, and see our results. I come from the Cleveland Clinic. I did my training there. We've got doctors from the best institutions across the country and internationally, and nobody has ever demonstrated the kind of improvements that we're showing in diabetes care, in chronic kidney disease care, in the transitions of care for COPD, and the innovative program for cardiovascular prevention, the way that we're tackling pain and physical disability through our physiotherapy program, the way that we're tackling mental health, like our Serenity division that is helping so many patients. And so it's not any one thing, but rather about having a care platform that measurably improves access, quality, and wellness, so that we can get better, more equitable, more accessible healthcare at a lower cost. Because if we do that, then we can have an impact at something that has eluded this country. And this country is the best in the world. I'm so proud to be an American. But our healthcare system is broken. our healthcare system is inequitable. And if we are doing what we have demonstrated at a regional level, we have a true shot at directly and indirectly through how we're inspiring others through making sure that our healthcare system is the best in the world.
And you know, now that you say that, I serve in an advisory board of UHealth and Vanderbilt University on health disparities. And I really feel that passion. Of course, I'm not a doctor, I'm a political scientist. But I feel the passion, and I know that it's very important now that I've been serving in that board for 5 years, because Hispanics that are high risk, like you said, diabetes, blood pressure. There's so many things that we can do, because Hispanics are always taking care of their parents, the abuelito, and then we forget about ourselves. And what you're saying touches my heart, because I know how it is and how much Hispanics need what Cano is offering them. And I'm very happy to be here today. Is there anything I left out? I know it's a short segment, but it's been very inspirational. Everything you said and the passion that you convey through the cameras and the speaker really makes me feel good. Anything I left out that you would like to say before we close the show, Dr. Marlow?
Really appreciate the invitation and the true honor and pleasure of being here with you and speaking about this labor of love that is Cano Health. And there's one thing is that while we serve a lot of minorities,
of course,
Hispanics and African Americans included, and many other underserved groups, this is a quintessentially American enterprise that has a very legitimate shot at transforming our nation's healthcare so that we can help more people pursue the American dream. And
as a Cuban American, I'm very proud to know you. I'm very proud to have Cano Health as a member, to have one of your VPs in the board of directors of the South Florida Hispanic Chamber of Commerce, and I salute you and everything that you do. So thank you so much for your time, Dr. Marlow. And all of you, I'll see you next week at the same time, and I